Did you know that 1 tablespoon of vinegar in a tall glass of water before your meal reduces the blood sugar spike by 30%? Keep watching to learn 5 ways to reduce blood sugar spikes in your body. Sugar spikes occur when your blood sugar rises and then falls sharply after you eat. For this, a term known as glycemic index or GI is used. This ranks the carbohydrates from 0 to 100, and this tells us whether a carbohydrate is likely to increase the blood sugar levels rapidly. Now what happens is when the blood sugars rise very quickly or there's a spike in your blood, the sugar falls very rapidly and it causes the body to enter a phase known as the crashing phase. Now, why this happens is because when the sugar is released, there is an insulin or a counterbalance of that sugar that is released into the bloodstream. What this does is, in the short term, it leads to lethargy and hunger, whereas the repeated spikes in your blood in the long term can lead to heart problems, kidney problems, problems with the eyesight, neuropathy, and it can eventually lead to type 2 diabetes. Now, the first thing you can do to reduce the number of blood sugar spikes you have every day is to have 1 tablespoon of vinegar in a tall glass of water before your meal. This has been linked with weight loss, cholesterol reduction, and it also has antibacterial properties. There are several studies that show that consuming vinegar can increase the insulin response or the insulin sensitivity, which is very important for the type 2 diabetic patients, by 19 to 34%. Also, a study in Japan found out that adding pickled food to rice decreased the glycemic index of the meal significantly. Now, pickled foods are those that have been immersed in vinegar for a very long period of time. To control the blood sugar spikes, you should build a habit of exercising regularly, as this helps control the blood sugar spikes by increasing the sensitivity of your cells to the hormone called insulin, which is released in response to the sugar that you eat. But what if you have already had a carbohydrate rich meal? What you can do is you should exercise or lift weights so that the sugar in your bloodstream goes right away in your muscles, or the muscle cells absorb the blood sugar so that the sugar levels in your blood are lowered. Both high intensity and moderate intensity exercises have been found to reduce the blood sugar spikes. Masking your carbohydrate meals is a very intelligent way of consuming carbohydrates and not worrying about the blood sugar spikes at the same time. By having a fiber first approach, in which you will have your fiber such as legumes, nuts, oats, fruits and vegetables, and then you will have your carbs. This way, fiber makes a gel-like substance with water which slows down the absorption of carbohydrates from the gut, and this results in a steady rise and fall in the blood sugar rather than a spike and the crash that we have already discussed. You need to choose your carbohydrates. Why? Because the refined or the processed carbs like table sugar, white bread, white rice, candy, soda, breakfast cereals, desserts, and any packaged goods have a very high glycemic index. Now, this leads to a very sharp rise and fall in the blood sugar, leading to repeated spikes, and this should be replaced with good carbs like fruits, brown rice, quinoa, oats, beans, and sweet potato. Other than this, you can have magnesium, which is a mineral which helps to control the blood sugar levels. A study found out that magnesium increases the insulin sensitivity, and when given in combination with chromium, it has a synergistic effect of increasing the insulin sensitivity. And magnesium can be found in spinach, almonds, avocados, cashews, and peanuts. If you found this video helpful, please give it a thumbs up and subscribe for more content like this.